I can't hear you. Oh boy. I can't hear a word. Let's see. Can you hear me? I can't hear you. uh, all right. Should we try this again?
Okay.
Okay. Okay.
So you can hear me now?
Yes.
All right. Thank God. I don't know what the difference was, but that's
All
been
right.
fun.
Got it. We're
Yes. All
going.
right.
Okay.
We're going live.
Sorry for all
That's
the
it.
sorry for all the technical
That's
difficulties. I'm sorry.
me too. I thought I was technically savvy, but clearly I'm not. Okay.
All right. So we'll skip all the small talk and we'll go straight to business.
Right.
All right, guys. Thanks for joining us today. We are going live with SBH updates. We're talking about IBS and IBD. I would like to give Rebecca Cohen-Sakal a thank you for putting this all together. She's the medical events coordinator at SBH, and we are here with Dr. Saha. He's a GI at Mount Sinai and at Park Avenue Medical Professionals. I am Victor Gindi. Most of you guys know me as your local photographer, but I also run two support groups. One for people who have IBD, which is Crohn's and colitis, and one for people who have gone through the J pouch surgery, which we won't really be discussing tonight. Dr. Saha, welcome.
Thank you, Victor.
Thank you.
Sure.
Yeah.
Thank you, and Rebecca for inviting us to be to be able to speak on this topic.
Yeah. It's a big topic, and it's a topic, and it's a conditions which are growing and expanding these days. So yeah. So everybody gets stomach aches every once in a while. Usually it's not a big deal. But if you're having stomach issues which are prolonged and going on, they need to be addressed. And we're going to talk about that tonight. And how to determine if it's IBS, irritable bowel syndrome, or IBD, inflammatory bowel disease. These acronyms can get confusing sometimes to people, so we're going to try to give everybody a better understanding between the two. So, Doc, do you want to explain what the difference is between IBS and IBD?
Sure. It's very important to make the distinction. It's not, such a clear distinction up front, right? Most people come uh, to the doctor after some time of feeling abdominal pain. They may have change in bowel habits. They may have, non-specific complaints of bloating. Sometimes they pass mucus. It can start even, as young as the teenage years or in the mid 20s, even up to mid 30s, let's say. Um, One should not ignore these symptoms after, let's say, if it's occurring 3 to 6 months, right? In short term, everyone's allowed to have any abdominal discomfort or pain or bloating and, irregularity. But once it becomes a little bit on the chronic side, over 3 months, let's say, they should seek attention. So the difference is, right, the irritable bowel, which people sort of make a quick diagnosis. Doctors tend to do that. It's just like, oh, you have a nervous stomach, and relax. Take care of your stress, and everything will be better. But it's not infrequent, right, that people ignore them too long, and then they actually have a disease, which is inflammatory bowel disease, which is actual inflammation of the lining of the intestine, and it can have serious consequences. Whereas IBS is just what we call a syndrome. It's not really a disease. it's more symptomatic. It's just, problem of like function, and behavior, I guess. So we treat them differently, and we can get into that later.
Okay, yeah. How common is IBS versus
Yeah,
IBD?
IBS is extremely common, probably anywhere from 10 to 15% of
Of the
the whole entire population, right? So
a
that's a
lot of
very common.
yeah.
Yeah, I mean, and anyone can have IBS symptoms, irritable bowel symptoms, even prior to, stressful situations such as a test, coming on, Instagram Live, whatever, right? Just have these just rumblings in the stomach, a little pain, little gas, little bloating, little cramps. Um, Whereas IBD, it's not as common, but it's not insignificant. Probably in the order of maybe 1% of the North American population. So it's really not, rare. And it's important, again, to make the diagnosis because it has implications down the line.
Yeah. So now, very often these conditions, people don't want to think about them too much or give it too much attention because sometimes it's embarrassing. You go to the bathroom more often, that sort of thing, and you don't want to bring that up to other people. But it's important to, if you're having these issues, it's important to understand what's going on and get them taken care of. Right, doctor?
Correct. Again, so my first suggestion to those who have, again, persistent abdominal pain the last few months, um, uh, again, the IBS can have constipation, not so much with irritable inflammatory bowel disease, but any change in bowel habits that's bothering you. Certainly, if you see blood in the stool, weight loss, decreased appetite, even skin rash or joint pain, that's definitely more a sign that you have to get immediate attention. But even those subtle symptoms of abdominal pain and bloating, and even sometimes inability to sort of have a normal bowel movement, right? We call it hesitancy, right? They should also be checked because that can also show, indicate that they have some inflammation sort of lower down. So there's, we'll go into it like two types of inflammatory bowel disease, right? You have Crohn's disease and ulcerative colitis.
Right. Do you want to explain the differences between the two?
Sure. They're both inflammatory conditions of the colon, right? But Crohn's disease can also affect any part of the intestine. That includes the stomach, the small intestine, and the colon. So, and typically the pattern is what we call skipped. It's not in a contiguous form. It can occur any random places. Typically, they have deeper ulcers from more significant amount of inflammation. Ulcerative colitis only affects the colon. It can start lower down and then sort of affect the left side or the whole entire colon. Those are they're just big, broad category differences.
Right. Are any of these conditions curable?
There's no what we would say cure, but what we're trying to do with treatment of the disease is try to reduce the symptoms, the reduced inflammation. So first you reduce the inflammation, the bowel sort of heals, gets better, patient's symptoms feel better. They also have reduction in after a long period of time, you actually have risks of other complications, right? They include obstruction, maybe an abscess, um, um, even increased risk of cancer over a longer period of time. So early detection, early treatment is extremely important for these reasons.
Okay, so let's talk about the symptoms, I guess, between IBS and IBD a little bit more. With IBS, bloating is common, constipation, looser stools, and sometimes it alternates between the two. If you're seeing some mucus in your stool, that can also be an indication that it's IBS. But that also can be indication of IBD.
Correct.
So now, what are the differences that we should be looking for between IBS and IBD? I mean, I know fatigue can happen for both, or
Yes. Yeah.
more.
Yes. But it is like a sign that you should have further investigation if you have fatigue, that you may have IBD, right? But fatigue is very sort of vague symptom, right?
So I'm going to punch in a little bit of my
Sure.
story. So I was diagnosed with colitis 21 years ago, and one of the first symptoms that I had was extreme fatigue. And I was a very active person. I played hockey once a week. I was in a hockey league. I was in a basketball league. Very active guy. And I was in college, and this fatigue was just crippling for me. And I was like, what is going on? Like this was noticeable tiredness where it really prevented me from functioning fully. That was the first symptom I had. So I had that for probably, I don't know, a few weeks, 4 or 5 weeks. And then later on, I ended up seeing some blood in my stool. And that was the next indication for me to really get this checked out. And that's when I got diagnosed with colitis.
Sure. Wow, that is not a typical story, but I'm glad you followed through because typically, they have more bowel symptoms, right? So
Right. Yeah.
yours is a very good example not to ignore things that persist. So how about if we go into like some of the tests, right? So they
Yeah.
probably while you went to the doctor, right? Again, fatigue is very vague. Right, so he would probably, or he or she, right, would do some blood testing to do, see if you have any signs of inflammation. It's called sedimentation rate or C-reactive protein. Any signs of anemia, elevation of white blood cell count. We would also, you were not having any bowel symptoms, right, Victor? Or just the blood?
Yeah, I mean, I think I was going a little more often, but
Yeah, a little bit more
nothing.
right. So at that time, we could also do stool testing, and we'd look for, signs of blood. There's markers of inflammation called fecal calprotectin,
Right.
and then depending on what these preliminary tests show, we can go further, and then we can go over it later as well. Endoscopy or colonoscopy and
Right.
further imaging, right?
And from that, you could also do biopsies to do that, but whatever, we'll talk
Right.
about that after. I mean, what are you looking for in these tests exactly?
Well, again, so on the blood test, we would just look for any markers of inflammation, right? That could be indicative of something beyond just a symptom of fatigue or symptom of constipation. These are treatable different ways than actual inflammation and disease.
Right
So
now,
again,
right, you'd also test for parasites and that sort of stuff, and
that's
those.
right. Sure, right. Especially with someone with new onset diarrhea or maybe recent travel or antibiotic use,
Right.
we would have
So
tests for stool.
right, that's what I had. There's two types of colitis, right? There's acute colitis and then there's chronic colitis.
Right.
Correct? Right.
Well, also within the acute colitis, there's a number of other reasons that can cause it. It can be infectious, is another is a big subcategory. Or there's also toxin related, people who have had recent antibiotics, either
Mm.
for dental procedure or sinus infection or urinary tract infection, they can have this C. difficile colitis. So that has to be ruled out as well.
So that, I mean, what happens there is the antibiotics end up depleting the good bacteria in your colon, and then your body ends up reacting to that.
That's correct. Very good. Yeah, that's exactly right. We get rid of not only the bad bacteria, but the good bacteria, and you're left sort of, vulnerable to this toxin.
Right. Right. Yeah. So if someone ends up getting diagnosed with IBS or IBD, how do you treat the two? We'll start with IBS first. How do you treat IBS?
Right. So with IBS, right, the goals of treatment is to treat their symptoms. So we can start with, depending on whether they have diarrhea, we would try an antidiarrheal to slow things down. If they have constipation, we would work on their diet, whether to increase more fiber in their diet, or even through supplementation, or mild, gentle laxatives such as Miralax or Colace or the Dulcolax, things like that to help soften. Now, if they have other symptoms such as pain, we can give an antispasmodic such as Bentyl, or if they have gas, bloating, again, dicyclomine, hyoscyamine. These are like for spastic colon, we call it. And sometimes just even something for gas, like, Gas X. So it's more really symptom oriented for treatment of IBS.
Right. And,
We also do.
and then do you also, ask them, how their lifestyle
Correct.
is,
That's
what's it,
what I was going to say. Right.
what
We
diet?
do, yeah, do look into their stressors in life, right? They're feeling uh, recent anxiety, some depression, not just chronically, but, something just acutely may have triggered something. They just have to go through some stress, like short term, and then, we help them to deal with that.
Well,
And then
the gut is your second brain, you have a
that's
gut
right.
brain. So,
I always tell people the gut does not digest anxiety very well.
right.
So,
Right.
right. So
I mean, do you ask them about their diet? If they're eating a lot of processed foods, sugars, alcohol, that sort of
I
stuff?
do go to the into their history as far as dietary. I just want to make sure that they have. I like to tend to focus on what we call the whole foods diet, not typically the store, but like real foods, right? Stay away from processed foods and then refined sugars and maybe reduce alcohol and even healthier foods that are gas producing, right? So such as broccoli,
Mm,
cauliflower. Um,
beans, that sort
yeah,
of
that's
stuff.
right. Lentils and the beans. It's, they can also cause a lot of symptoms, even though they're healthy for you. But
Yeah. So what I'm trying to get across is, if your gut is acting up, it might be in a little bit more of a fragile state. So you want to be a little bit more careful of what you're putting in yourself, in terms of sugar and alcohol, because these are stressors on the gut.
yes,
So
I mean they are pro-inflammatory as well, even
right.
not necessarily like right Crohn's or colitis inflammatory, but
Just, yeah.
But then going on the other side of the treatment is inflammatory bowel disease, right?
Right.
We're treating the inflammation, and I think this is beyond the scope of our discussion today, but there's multiple layers of
Yeah.
treatments, right? Anti-inflammatories,
We,
antibiotics.
we could start another
Yeah,
live for
exactly. It's too much, right? But the treatment, but point is, the treatments are much better these days than they were in the past. So it, reduces the complications, right? But again, so to emphasize the importance of early detection, early diagnosis, just again to prevent complications. And then also that will guide our treatment to reduce the inflammation.
right. So I know I've kind of seen where the medication has gone over the last 20 years from when I first diagnosed to today. And it's pretty amazing that the medications today, really how far they've come along and how effective they are. Um, when I first started my support groups, there were many cases that were just very difficult to run, and they just kept on having flare after flare. But now most of those people on the newer medications end up becoming much more managed now, and it's really incredible.
Yeah, incredible, and also less incidence of side
Right.
effects. Some of the prior strong ones, right? That you would maybe sometimes have significant side effects, even increased risk of lymphoma and other side effects, right? But yeah, no, the treatments out there are much better than they ever were before. So
Right. Um, let's go back to the
Mhm.
testing for a little bit. I want to make a point that if you're having symptoms, I mean, people are petrified, we'll call it, of getting a colonoscopy.
Yeah.
But if you're having symptoms and the early tests may show something, it's really important that you get this test, because this will really give the doctors a clear way of seeing of what's going
It's
on.
the gold standard, right? So the preliminary test, blood test, stool testing indicates that that's the direction to go. And sometimes it may be negative, and the doctor's suspicion is high that this is something else going on here. It just doesn't feel right. So colonoscopy is really important. I know it gets a lot of negative press about the preparation, the pain and suffering you'll feel while you're doing it. But we sedate you. Our instruments are much better than ever before. Our sedatives are also much better, such that they work very quickly and wear off very quickly.
For
And,
performance,
and
don't feel things.
yeah, right. And you cannot have an alternative to this to get the diagnosis. The best way to get the diagnosis through colonoscopy. You can see the lining, you see some inflammation, some redness, you take a focal biopsy, and you send it from microscopic testing, and then you'll know right away. Uh, you know, the doctor can also tell from the colonoscopy right after the test how severe it is. Hey, this is mild, moderate, severe. We have to treat you this aggressively or that aggressively. So it's indispensable. And it also like for Crohn's disease, it can help you distinguish between Crohn's disease and ulcerative colitis depending on the pattern, and then the it's sort of the way, again, if it's contiguous or it's skipped, or it involves the small intestine, right?
Right.
That's where most of the most of the Crohn's disease is involved at the end of the small intestine, beginning of the colon. So it's really important to make that the diagnosis through that. Let's say the colonoscopy is negative. There's other tests that may need to be done, including a CAT scan or an MRI that looks at the small intestine. Even a capsule. Some people use, they're able to they need to undergo a capsule study where they swallow this capsule and they take, pictures as it goes to the small intestine. So
That's the next gen.
it is. It's been around for a while, and it's important stuff.
Yeah. I just want to give a little anecdotal story, one that I think kind of proves the point. Doesn't involve me. Involves the old rabbi of my shul, and my friend who happens to be a GI, who happens to be a member of the shul. I know the doctor was having a lot of gut pain, and I think he was starting to see some blood. And he's a proud man. He didn't want to really cause a ruckus, cause his wife to stress out, cause his congregants to stress out. So he went over to my friend the GI privately, just kind of told him like what's going on. He's going to the bathroom more often, and he's seeing some blood. So he told him to come in, make an appointment. They did a colonoscopy, and
Yeah, colonoscopy can definitely save lives.
yeah,
Third most common cause of cancer in men and women. It's probably second um, highest cause of cancer-related deaths. So it's very important. And just kind of along with this, they moved the screening age from 50 to 45 because we are seeing colon cancers earlier
wow.
age. So it's really important. And then also, especially if those patients with IBD, either Crohn's or colitis, after let's say 8 to 10 years, the risk increases. So you also have to those patients have to get more frequent colonoscopies, um, probably in the frequency of maybe 1 to 3 years, as opposed to 5 to 10 years for the average patient.
And something we just kind of touched on before, but um, I just want to reiterate that IBD is becoming much more common now than it was 20 years ago,
Right.
30 years ago. It's more prevalent now. So
Yeah, it's usually it probably is a combination of maybe the processed foods our kids are eating or we're eating, and also better detection.
Mm.
So, it may be a combination of both. So we don't
Maybe
know why.
overuse of antibiotics as
That,
well. I think.
that's certainly a possibility.
Yeah.
We don't know fully what triggers
Right.
it, but there's multiple mechanisms.
A lot of theories going on that stuff.
Yeah.
Yeah.
Right.
Yeah. Does anybody have any questions that you want to ask Dr. Saha? We'll give this a couple of minutes, see if we have any great questions that pop. I know the feed's been kind of rolling. It's like 2 lines, so I can't really.
Right.
Do probiotics help? I mean, we could talk about that for IBS and IBD.
Correct. We don't know. It hasn't been proved, right? But we do now. The current studies are showing that the bacteria that we carry inside of us does affect our immune system one way or the other. So I do recommend probiotics. I don't think it's a cure-all for everybody or it's a cure necessarily, but it does, I think, it's an adjunct therapy. It does, you bring in good bacteria, you want to have good byproducts of the bacteria and the body, the way it works from the products of what we eat through the bacteria. But it's not a
Right.
cure.
But it's, you want to incorporate, fermented
Right.
foods into your diet.
Right.
That's a good thing to have. Can we talk about fiber?
Sure. So fiber, it again, not a cure of, let's say, IBD. It certainly can be helpful in IBS. Sometimes in those who have active flare-ups of Crohn's or colitis, fiber actually may be, I wouldn't say harmful, but it makes their symptoms worse, right?
We,
Because they can't absorb it.
right. Are we talking about soluble fiber or insoluble fiber?
Well, it kind of depends, right? So insoluble will go through, right? If you have an active flare, it's not going to help with the symptoms. Uh, if you have diarrhea, it's going to continue the diarrhea. So you just have to take it on a case by case basis. As far as whether, again, it would be more for symptoms rather than a cure.
But again, you want to feed your body the right things at the right time.
Always.
So it's good
That's right. And again, stick with real foods.
Yeah.
Right.
I'm going to see if I could, looks like we got a bunch of questions. So I'm going to try to scroll up and see what's going on over here for a second. Are there any natural supplements that you recommend in addition to the traditional meds?
I'm not really a big supplement guy. I think I'd rather have my patients get their vitamins through their foods. But obviously, if let's say an IBD, a patient's actively inflamed, it's hard for them to absorb, let's say, iron. So I would have patients take an iron supplement. Sometimes, even omega-3 supplement to reduce inflammation. That certainly may not hurt. That would be helpful.
And what about vitamins B and D?
Again, I am a believer in those specifically. I do tests for them in my patients. So if someone has B12 deficiency, especially if they have Crohn's disease involving the small intestine, they will have low vitamin B12. I will certainly supplement that. And D, I'm a believer also in keeping vitamin D levels good. I think it helps the immune system.
Right. Okay.
Sometimes I get asked, can IBS turn into IBD?
Mm.
I would say no. There's no evidence that shows that, but it may be that there was maybe at the time where the patient was evaluated for IBS versus IBD, that the markers or they didn't find the area where, let's say, there was IBD. If later on they, initially diagnosed with IBS, but one does not lead to the other. And I saw a question at the bottom of the screen: can you have IBS and IBD? The answer is yes, but it would be, can you have IBD? And then what you would do is you would have IBS symptoms. Again, remember, the disease, you can have also the symptoms.
Right. Awesome. Are any of your patients ever able to get off, any of your IBD patients ever able to get off of their medications or end up in full remission?
That is, yeah, it's more common than you would think. There are people who we maintain on a very low dose of, let's say, an anti-inflammatory, but there are people who are able to get off of it after what we call remission, where the inflammation has been sort of calmed. Yes, there are people who do not need medications after initial flare.
Okay.
So that's good.
Awesome. I think we're all right. Is there anything else that you want to tackle today?
Well, that was a very big topic, but I think to stress the importance that after some time, do not ignore your symptoms. Go to the doctor early because IBD is treatable. It's not curable, but it's very important to get early treatment to avoid potential complications. Again, blockages, cancer, and even need for surgery because the disease gets out of control. So it's best to get it treated earlier than later.
Right. Right.
Yeah.
Okay, great.
Right.
You want to wait another minute, see if there's any other questions that pop up?
Sure.
Okay. Some of them are getting kind of
Yeah, I
specific.
saw that one. That's the that's I think that'd be pretty specific. I think I don't want to tackle that right now because that would, you know what I mean? That's like for that specific cause.
Right.
Yeah.
Well, lifestyle changes would you recommend for those with IBS? We kind of touched on this a little bit earlier.
Right.
You want to keep your stress levels under control. You want to eat healthy, get enough sleep, stay hydrated.
Exercise is a good stress.
Yeah, so you got to do all those things. You've got to take care of yourself in all these different ways that'll help keep you healthy.
Right. Exactly. But yeah, it's just more that I think I would stress a more holistic approach, right, for the person.
Right.
In addition to the medicines to treat the symptoms.
Right. Okay, Doc. I think we had a good talk.
Great. Now it's great talking to you,
Great.
Victor. Thank you again for moderating and again for SBH for inviting me to speak.
Awesome. Okay.
Hope people learn from it and we'll help some people tonight.
All right.
Thank you
Until next time.
so much. All right. Take care.
Yep.
Have a good night. Bye-bye.